and welcome to our presentation of Payment Navigator, part of the Patient First Suite from MDeverywhere. In conjunction with our new partnership with U.S. Bank, we're pleased to provide your practice with access to Payment Navigator, which is the HSMA peer-reviewed patient payment solution. Clients who have utilized this service across the United States have found benefit in driving improvements in patient balance performance by offering more patient choices and channels so that they are more readily able to fulfill their financial obligation to your practice. Let's get going with the demo, and we'll start with Patient First. When patients receive their statement from your practice, they'll now note that they're able to pay online from your website. Through the implementation process managed by MDeverywhere, your practice will have a secure URL powered by U.S. Bank, which will allow patients to come online and make payments directly from their statement. It's a simple three-step process by inputting patient information, payment information, and then confirming that information, preparing a receipt. Payments can be made by MasterCard, Visa, Discover, or American Express, or for the convenience of your patient, they might also select an e-check option. That works for patients who have a preference to pay directly from their statement. But for those who would rather manage their accounts online, once they create a secure login, patients are able to view their balances, view statements, make payments, and as an option, based on your practice's preferences, can create their own payment plans. They're also able to manage their account online by going paperless. Let's go through an example. In this case, we'd like to take a look at our statement from our clinic. The patient simply clicks on the URL to view the statement, and they're able to view all of the activities related to their services from your practice. Your patient now has the ability to print this, save it, or they can securely store this within the Payment Navigator database. Statements will be held for a period of 2 years. If the patient's ready to pay, they can simply click on the Pay hyperlink, and you will note that all of the pertinent information regarding this payment are pre-filled. Optionally, you may request other information from your patient to make certain that you have the right individual, such as a date of birth, or perhaps you're interested in capturing email information. The patient also has the option to securely store a card on file. And in this example, the patient has done so, and they're requested to input their security code to validate the payment transaction. We're going to then go click on Next, which is the second of our third steps, to confirm that all of the information that has been input is accurate. Once that's complete, we'll go to our Confirm button, and we'll now produce a receipt. This is all from the convenience of your patient's PC, where they're able to, again, manage their account, view their statements, make payments, view history. At this point, the patient has an option to print the receipt, download it, pay another bill. They could also email this to themselves. But in this example, let's go ahead and close. That's the view from your patient's perspective. Let's switch seats. At this point, we're now going to move into your practice, where your staff members will be able to facilitate payments using card, cash, or e-check options for both manual checks and e-checks. Today, our patient, Barbara Martin, is coming in, and she'd like to make a payment for her co-payment. Barbara is going to be presenting her health savings account card, so we're going to input the dollar amount. We've input her patient ID and name. Now we're going to go ahead and swipe the card using a small swipe device. You'll note that card information is loaded into the system and is grayed. All card data is securely stored within the Payment Navigator database. At this point, we'll go ahead and click on Submit and authorize this transaction in real time within the payment network. As part of the solution, you'll have an integrated receipt that can be printed or directly emailed to this patient for any of the payment types that are made. A nice feature that allows you to keep track of all activities. And for those payments that are made via the web, we'll be capturing all of that information within Payment Navigator as well. Another example might be that our patient has come into the office today, and he indicates that he would like to make a payment on his bill, but he forgot to bring his bill with him. In this example, your staff members will go to patient billing, will look up our patient with the last name of Monica, and search. At this point, we're going to be presented with two options for our patient, Santa Monica. We want to go ahead and see what's available. Let's click on View Image. Now, this is your staff member who has access to all of the statements that are delivered to your patients. You'll see the patient statement. You might want to print this out for the convenience of the patient. And once your patient is ready to pay, your staff member simply clicks on the Collect button. At this point, you'll see that the dollar amount has been pre-filled. Depending on the nature of the payment, you might want to go ahead and create a payment plan for this particular patient. Again, you'll see the payment data is brought forward. How do we want to pay? In this example, the patient would like to pay by card. Once again, we'll go ahead and swipe that card to our certified device. Card information is pre-filled. The total amount that was due was $298. In this example, we're going to allow this patient to pay over time $250 because today we're going to take a payment in the amount of $48, fulfilling that financial obligation. Patient is going to pay monthly in the amount of $50. And we're going to go ahead and start this payment on the 8th of December. We'll go ahead and save these transactions. And what will happen at this point is a transaction will be created for $48 for the first portion of this payment, and we'll produce a receipt. And next, we'll produce a receipt for the payment plan that indicates $250 is due. We've made a down payment of $48, and we're going to pay monthly in the amount of $50. Automatically, these transactions are kicked off so that you do not have to contact the patient for additional payments. But they will be part of your posting process that will update your accounts receivable. Now, all of these payment plans are in accordance with your practice's policies, so it can be a very useful tool. One last item. We mentioned an e-check option. So in this example today, our patient Barbara Martin once again is coming in, and she wants to make a payment by check. Depending on the scenario, you might accept a check manually, meaning you would post the transaction and deliver that check to your bank. If the patient is present, you'll have a swipe device that is both card and e-check ready and will be able to convert that piece of paper into an electronic transaction. If you receive a payment in your back office and you'd like to go ahead and process it, that would be patient not present. Again, you're going to be converting a paper transaction into electronics. But our third option might be a telephone payment. If you were taking a payment by phone and the patient wanted to pay electronically by check, you can go ahead and put in the information from their routing number and their account number. And we'll go ahead and make the payment electronically. That's just a few examples of the use case scenarios that you can have for Payment Navigator. Again, our integrated receipt, which can be emailed or printed. Hopefully you'll see that the functionality is very strong within Payment Navigator, and we can create various applications for how you can use the strength of Payment Navigator to improve your patient balance performance. But all of this information is very important for you to know, in that you have the ability to retrieve and do various types of research simply by patient. Perhaps you have a preference to create an array of reports, including custom reports. But a workhorse report that we have and that many of our clients use is our end-of-day processing summary, EOD. And this report allows us to look at our payments by outlet or department. Perhaps perhaps it's important for you to look at this by user. And in this example, you can see that we've had 3 users online using Payment Navigator today. Jim, we've had an online payment, and Barbara Martin. If you'd like to see information about all these transactions, you simply click on the hyperlinks. But you'll also note that information is broken out by card, cash, check, or manual check, various options for you to consider. And when it comes to the breadth of the reporting, all of the transaction details for the payments that were captured across the channels are available for research and will be posted directly to your accounts receivable with MDeverywhere. We hope you found this presentation of Payment Navigator insightful, and we look forward to bringing you on board and allowing you to improve patient payments across all channels. Thanks for your time.